I rise today to begin the debate on Bill C-31, an act respecting the cost of living relief measures related to dental care and rental housing. Canadians across our country are feeling the effects of rising cost of living caused by the global inflation. The government has responded with legislation that will quickly provide relief to those who are struggling most. This proposed legislation aims to bridge the gap from Canadian families if passed. This bill will give an estimated 1.8 million Canadians an extra $500 to cover their rental through a one-time top-up to the Canada Housing Benefit. In addition, the bill creates the Canada Dental Benefit, which will provide needed dental care for children under 12 for low-income and middle-income families, helping an estimated 500,000 children. If passed, this legislation will help not only with the immediate effects of rising inflation, but will be very good first step to a long-term Canada Dental program. I begin my speech by talking about the Canada Dental Benefit, and will finish by talking about the one-time top-up of the Canada Housing Benefit. Dental care is essential to maintaining good oral health, especially for the youngest children, whose teeth are still developing. And yet, the reality is that professional dental care is out of reach for many Canadian families across this country. Seeing a dental professional can be expensive, and approximately one-third of Canadians do not have insurance cover for this cost. This means that many parents have to postpone or forego the important dental care for their children at a time when their teeth are developing. Unsurprisingly, research has shown that Canadians from low-income and middle-income families have worse oral health outcomes than those from higher-income families. This is a type of health inequality bill being introduced here today is trying to mitigate. In 2018, more than 1 in 5 Canadians reported avoiding dental care because of the cost. This is roughly 6.8 million people. The consequence of putting off dental care, or worse, avoiding it completely, can be severe. Left unchecked, dental problems can lead to as many health issues, including chronic disease like diabetes and heart disease. This, in turn, increases public health spending, cost-intensive healthcare systems such as cardiac, cancers, and emergency service. We've heard testimony at the National Finance Committee from Dr. Walter Sclera, a dean and professor of the University of Saskatchewan, who warned us about the dangers of health effects of not having proper oral health. It is clear that poor oral health places a significant burden on society as a whole. These direct and indirect costs affect all of us, and we all stand to benefit when we improve access to dental care professionals. When it comes to children, the stakes are even higher. The consequence of poor oral health in childhood can last a lifetime. Many oral diseases can begin in preschool. It may surprise you to learn that tooth decay is actually the most common childhood chronic disease in Canada and around the world. In Canada, the treatment for dental problems leading cause for day surgery under general anesthesia at children at the age under 5. Childhood is also a critical time for establishing good dental hygiene behaviors. Seeing a dental professional during these formative years can be instrumental in developing healthy habits that last throughout one's life. There is no doubt that inadequate access to dental care during the critical years have a significant effect on children, and that effect is more pronounced in certain groups. Research data shows that dental diseases are more commonly found among children from low-income families, Indigenous children, children with disabilities, and special health care needs. It is clear that some Canadian children are falling between the cracks. If we do not act now, these children may have to live without consequences of poor oral health for the rest of their lives. It doesn't have to be this way. With the right care, we can prevent minor dental issues from growing into major ones. For children whose lives are ahead of them, the benefit of access to dental care early is immeasurable. With this in mind, the proposed Canada Dental benefit is designed to help the youngest Canadian first, specifically children under 12 from low-income families who do not have access to private dental insurance coverage. The benefit will provide eligible families with payments of up to $650 per child under 12 years of age per year. The benefit will also be tax-free. I first want to address the issue of adequacy because of known several senators had questions and concerns about whether $650 per year is enough. I will make 2 points. First, the program is not to be a replacement or a substitute for existing private plans coverage. The intent of this interim program is to help ensure basic oral health can be available to children of low and middle-income families when they cannot access private or public coverage. So how was $650 amount determined? Health Canada officials, in collaboration with the Chief Dental Officers of Canada, examine average cost of dental care for a range of basic care needs by children, including exams, x-rays, fillings, and preventive care like fluoride and sealants. Based on the cost of these basic treatments and measures that they come up with the benefits amount to help fill, of course, the gap to ensure basic oral health care needs are met for children. My second point is a dental benefit program is an interim program, not a long-term solution to children's oral health care needs. More in-depth discussion will take place over the next 2 years between the federal government, provinces, and territorial governments, along with many main stakeholders, included dental healthcare professionals, to help inform a better and a longer-term solutions. If the proposed legislation is passed, eligible families could apply for the Canada Dental benefit as soon as later this year. Health Canada and the Canada Revenue agencies have committed to work together to ensure that Canadians receive their benefit payment as quickly as possible. Parents and legal guardians of eligible children will apply through the Canada Revenue Agency My Account or through their contact centres, after which they will receive an upfront payment that will allow them to take their children to the dentist. The money provided through the benefit will be used to cover oral health care service delivered by any regulated independent practice oral health care provider in Canada. To qualify for the benefit, applicants will need to meet certain criteria. They must have a child under 12 years of age in their care who do not have access to private dental care. They may be asked to provide information about the employer to help verify whether or not they have access to private dental insurance for their children. They must have an adjusted family net income under $90,000 per year. They must have filed the most recent income tax return. They must have a parent or legal guardian who will receive the Canada Child Benefit for eligible children. They must have spent or have a plan to spend money on dental expenses for the child that would be fully reimbursed under other public programs. They must provide information about the dental care visit and the dental care provider for which the benefit will be used. Children who are receiving oral health care services through other public programs, such as those provided by provinces and territory, or the federal non-insured health benefits for First Nation and Inuit program, may also be eligible for the Canada Dental benefit. However, they would still have to meet the other criteria. Most importantly, they have to have out-of-pocket expenses that would not be fully reimbursed under these programs. There have been some questions and concerns raised about whether you must pay up front and then wait for reimbursement. I want to be clear that the money dispersed through the Canada Dental benefit will be provided to eligible applicants upfront before they access dental care. By providing an upfront payment, the proposed benefit recognizes that many eligible recipients do not have a financial flexibility for reimbursement. In case of someone who paid for care before applying for the benefit, that person still apply to receive the benefits after the fact, as long as the care was received during the eligible period and was not reimbursed by another program, and they are eligible at the time they apply. The Canada Revenue Agency is well equipped to deliver this program with its extensive secure infrastructure and long-standing experience delivering benefits to Canadians. The agency will also be equipped to guard against fraud and ensure the program is being accessed as intended. The CRA will take steps to implement additional verification and security measures upfront to help ensure benefit payments are delivered only to individuals who are entitled to receive them in the first place. In some cases, CRA will request additional information or contact applicant's employer or dentist's office to validate the eligibility. The CRA continues to enhance the security of its digital service to protect Canadians from fraudulent activity. Security features include a multi-factor authentication and making emails address mandatory for those who use the CRA My Account. The CRA will lean heavily on a range of existing tools for administering other government programs, as set out in the draft legislation, to conduct compliance, verification, and collection of activities. I want to stress that the Canada Dental Benefit is just a start. This benefit is an interim solution to provide urgent support to those most in need. The benefit will provide immediate financial support to families, allowing them to begin addressing their eligible children's dental care needs as soon as possible. While the Government of Canada benefit is in place, the Government of Canada will be taking the necessary steps to build a comprehensive long-term dental care program that includes engaging key stakeholders such as industry and with experts of oral health and care industry. This past summer, for example, the Minister of Health and Public Service and Procurement Canada launched a request for information with industry representatives. As you know, healthcare is a shared responsibility between the Government of Canada and the provinces and territories. As always, the Government of Canada recognizes the respect and the mandates and jurisdiction of our provincial and territorial partners. All the provincial and territorial territories currently provide some form of supplemental coverage for dental service. These programs vary in scope and may only be available to specific groups such as seniors, children, or those receiving social assistance. But provincial and territorial programs do not cover dental care for children under 12 equally, in that in some cases the program focuses only on emergency needs. Some children under 12 who is also covered by provincial and territorial program may still be eligible for the Canada Dental Benefit if their family meet all the criteria to qualify for the benefit. If a family still have out-of-pocket expenses over and above those covered by the provincial and territorial program, they can apply for the Canada Dental Benefit to cover these extra expenses. For example, in Quebec, this program only covers up to age of 9, not 10 years old, not 11 years old, unless the parents are on social assistance program to access any types of benefits. Additionally, the Quebec program provides no prevention measures such as cleaning for children up to age of 9. Our recent experience with the COVID-19 pandemic has illustrated clearly that we can work together on healthcare priorities. As a result, we know we have the momentum we need to think big and to tackle largest system challenges. Building on the investment made to date, collaboration across governments, it is my hope that governments will continue to look to find ways to work with their province and territorial colleagues to develop shared vision for the future, one that includes expanded access to dental care. Canadians deserve a healthcare system that delivers results, and they expect their governments to work together to deliver value for their tax dollars. Honourable Senators, if passed, this bill will help bridge the gap for hundreds of thousands of Canadian children who cannot afford care. It will ensure that all children under the age of 12, no matter where they live, will have access to some dental benefits. The Dental Benefit Act also proposed an interim benefit because we recognize that children whose teeth are in developing must be a top priority. With this in mind, I would like to speak about timelines. Through Budget 2022, the Government of Canada committed to help the youngest Canadian access dental care before the end of the year. In order for this to happen, the proposed legislation must receive royal assent as soon as possible. And so I'm urging all honourable senators to support Bill C-31. As I briefly mentioned, C-31 also include a one-time top-up of the Canada Housing Benefit. It will give Canadians an extra $500 to cover their rent. The Canada Revenue Agency will process, of course, the application with payments on behalf of Canada Mortgage and Housing Corporation and the Ministry of Housing and Diversity and Inclusion. In other words, it will operate separately from the existing Canada Housing Benefit, which is delivered by the province and the territories across the country. Mr. Speaker, this is a one-time payment will have a far-reaching impact. The government estimates some 1.8 million people across the country will receive it, including estimates some 700,000 low-income renters in my province here of Ontario. Is this benefit meant to be a long-term solution for the affordable housing challenges we face in our country? Absolutely not. This short-term benefit is meant to deal directly with the short-term problems of rise in inflation that is hurting disproportionately low-income renters. According to the October report of rentals.ca, the average rent is now about $100 more than the pre-pandemic peak level from the fall of 2019. The $500 rental benefit will help cover some of this increase over the short term. But I think we can all agree that more needs to be done in the long term to help Canadians deal with housing affordability. We'll have already heard the broad strokes on the one-time top of the Canada Housing Benefit. Now I'd like to spend some time answering some of the questions that my colleagues on all sides of the Senate may have. First of all, let me explain who is eligible for the benefit. Individuals will be eligible if they have completed their 2021 tax return, and if based on the return they have an adjusted family net income below $20,000 or $35,000 for families. To be eligible, people must be a resident in Canada for the tax purposes in 2022, and their principal resident must be situated in Canada on the latter of December 1st, 2022, or on the day the Act becomes enforced. They must pay rent for their own shelter in Canada in 2022 and paid at least 30% of their adjusted net income on rent. People must apply for the benefit via the Canada Revenue Agency secure account portal by calling CRA contact centre. The government expects people can apply for the one-time top-up of the Canada Housing Benefit by the end of 2022, and their application period will be open for 120 days. To ensure they get the benefit as soon as possible, the government will encourage applicants to sign up for direct deposit, which can be done through CRA Secure My Account portal or through my Canadian financial through many Canadian financial institutions. Those who apply are eligible to have sign up for the direct deposit will receive their payment quickly, 5 business days. Those who haven't signed up for direct deposits can expect to receive their payment by check within 10 to 15 business days. Speaker, some people might be worried that this benefit would impact other benefits they rely on. I can assure them that the nature of the one-time payment of $500 value would mean that this is a non-reportable on the income tax perspective. Will not reduce their other income-tested benefits such as the Working Canada Benefit, the Canada Child Benefit, Good and Service Tax Credit, the Guaranteed Income Supplement. Our government will work with the province and territory to ensure benefits they administer will not be negatively impacted by this benefit. Mr. Speaker, the government has designed this benefit so that it will make a difference in the families that need it the most, without creating more inflationary pressures on the housing costs. That is because it is relatively modest one-time payment paid directly to low-income renters. We know that many homeowners are also struggling to make ends meet. But for this legislation, I believe the government is taking a targeted approach, focusing specifically on renters, households where this investment can have the most impact. That's because research shown that renters are 4 times most likely to experience core housing needs than homeowners. So, Speaker, I conclude, and I want to make the last important point. The one-time top of the Canada Housing Benefit is one of the measures in the toolkit of solutions to addressing housing affordability. We know that reaching housing affordability calls for significant investment over the long term. It calls for a comprehensive plan that benefits all Canadians, no matter where they live, along the housing conundrum in this country. This plan exists. It includes measures to put Canadians on a path to double the housing construction over the next decade. It will help Canadians save for and buy their first home, and it will ban foreign ownership and curb speculation that both make housing expensive for Canadians. Central to the plan is the Canada National Housing Strategy. This 10-year strategy, backed by more than $72 billion in investment, is making a real difference in the lives of Canadians. And the strategy keeps expanding to address housing affordability from every angle. Speaker, I trust I've been able to clear up some of the most pertinent questions about the one-time top-up of the Canada Housing Benefit. In conclusion, I know that Canadians are counting on all of us to deliver what they're asking for and what they deserve, including a safe, adequate, and affordable place to call home. No child should have to suffer poor oral health simply because their family does not have the means to pay for dental care. Painful dental problems do not have to be part of childhood, not when professional dental care is widely available in this country. In Canada, I hope we can all agree that every person who needs medical care should get it, regardless of their ability to pay. Seeing their dentist should make no difference. Canadian families in need have waited too long to access essential care for their children. This legislation has the potential to make a powerful difference in the lives of children and the adults they will eventually become. By acting now to ensure a better access to dental care for our youngest Canadians, citizens, we're investing in the health of the whole cohort of Canadians. There can be no doubt that such investment will pay dividends for many years to come. I hope we can count on colleagues from all sides of the Senate to support this bill and much-needed financial relief that will bring for those who need it the most. Thank you kindly.
Sénatrice Miville-Deschênes, vous avez une...
Senator Miville-Deschênes, you have a question? Yes, would the senator agree to take a question? Senator Miville-Deschênes. First, thank you, Senator, for having agreed to sponsor this bill. I have a question on the part which deals with housing. In its study on C-31, the Parliamentary Budget Officer noted that 86,700 Quebec renters will not be eligible for the benefit because they spend less than 30% of their income on rent. Yet, generally, these are low-income people who live in subsidized housing. Quebec would be the most affected because we have more affordable housing units than elsewhere in the country. Elsewhere in Canada, about 118,000 people would be excluded from the program. So, Senator Youssef, should the 30% criteria be changed to include more renters to make them more eligible for the benefit? Senator Youssef.
Thank you kindly for the question. My understanding is there have been amendments made to the bill at the final moment in the other place. But to be certain, in regard to the specific nature of your question, 3 ministers will be before the committee tomorrow, and I will raise it on your behalf to ensure I get the proper answer, to ensure I'm not misleading you in regard to my response. Thank you kindly.
Senator Batters, we have a list.
Thank you. Senator Youssef, thanks for your speech. In my province of Saskatchewan, my understanding is that very, very low-income families receive dental coverage for their children, and many Canadian families, of course, with health plans through their employment receive dental coverage for their kids. So what does the Government of Canada estimate the percentage of Canadians who are not otherwise covered by dental coverage who will receive this particular benefit?
Senator Youssef.
First, Senator, thank you for the question. Clearly, as you know, there are very different programs at the provincial level and territorial level across the country that help families access certain aspect of dental care. In the province of Saskatchewan, it is estimated some 49,500 families will be able to access this program that the government is putting forward. Across the country, I think there is expectation close to 700,000 families might be able to utilize this program either to supplement the provincial or their territorial benefits in regards to some of the needs that they may need to access in regard to give their children the proper care they deserve.
Senator Batters.
Thank you very much. Senator Youssef, it appears that the government leader will unfortunately not be giving a second reading speech so that we'll have the chance to ask him questions about this bill. So therefore I have to ask you this as the sponsor of the bill, this important government bill. We have a mental health crisis in Canada right now. I personally haven't heard the same thing about a dental health crisis. No doubt it's important, but I don't think it rises to that same level. The Trudeau government in the last election made a very significant promise on mental health care, promising to establish a Canada mental health transfer to the tune of $4.5 billion, with the amount of $875 million that should have already been allocated and transferred. But none of that money has flowed yet. Why did the government choose to spend this money on this particular aspect and not on mental health?
Senator Youssef.
Once again, Senator, thank you very much for the question. As you know, mental health is an issue that we all have to be concerned about as parliamentarians. The government have already made significant, of course, commitment to the provinces during, of course, the COVID period, transfer money to the province to help deal with the mental health issue. And I'm sure as the provinces and the territory and the federal government continue to talk, there will be additional support for the provinces in regard to the mental health need of Canadians right across the country. But equally so for many working families, while you did not hear about their need for dental health support, working families have been struggling with issues for quite some time. And at the end of the day, I know for a fact, based on the estimate that the government provided, many families will be assisted. I don't think we should prioritize dental care and dental support for working families over that of mental health. They're both equal. And if you ask a family who are struggling with these issues, at the time you approach them, they will tell you what their priorities are. So while I recognize mental health is an important issue and we need to find ways to continue to support our provinces to ensure that Canadians can get the services they need, we should not somehow distinguish in terms of priority, because when a family is struggling with an issue, that will be their priority. And dental care, I know for many working families in this country, is a significant priority because they can't afford to access dental care in this country.
Honourable Senators, the list is as follows. Senator Gignac, Wallen, Deakin, Ontario, and Wells. Senator Gignac.
Thank you. So, Senator Youssef, you accept another question? Okay. So first, I want to congratulate you as a sponsor for your involvement in that. I think many of us, not to mention majority of us, agree that we have to do something. I think you have to be back in the 60s in the Royal Commission, 1964, that it was, in fact, mentioned that dental services should be part of the national system. Having said that, many provinces offer different programs. And interestingly enough, the PBO has mentioned that in the cost of $700 million, Quebec residents will receive only 13%, since Quebec has been pretty generous with the system they have in place. in precise dollar, Quebec, over the next 5 years, in fact, will receive 92 million, which is, in fact, equivalent to Alberta, but with a much bigger population. So my question is this one. Since you have probably contact with the cabinet minister, do you think that it would be a good idea to offer an opting out for provinces under certain condition that the provinces will receive the money, okay, but they have to respect some condition? I think would be much more efficient since dentist is provincial regulated and they have contact with the dentist rather than going to that system.
Senator Youssef?
Senator Dignac, thank you very kindly for the question. As you know, the Quebec program only allowed those 9 years of age to access a dental care, and it's under certain conditions and is income tested. In the next 2 years, the federal government and the province will be in some serious deliberations about what a national program should look like. At that time, I'm certain, as Quebec have done throughout history, it will negotiate, of course, a way for it to be compensated for a program that has some national standards. But I believe, given this as an interim measure, I think it's fair for families to know, those who have children under the age of 12, they will get this benefit and it will help them get the care their children need. But in the long term, as the federal government and the province and the territories negotiate, I hope we can have some national standards, and if Quebec, of course, meet those standards, by all means, they should be compensated. Thank you kindly.
Colleagues,